Good morning, everyone.
Good morning.
I'm very happy to be here today. My name is Julie Knight. I am an infection prevention nurse here at the Seattle Cancer Care Alliance. I have worked here for over 15 years. The first 13 years I worked here was in the procedure suite, and many of you may have been there for patients who've had different procedures like bone marrow aspirations, endoscopy procedures, central venous catheter placements. That's where I worked for the first 13 years. A couple of years ago, I had an opportunity to move to the infection prevention program, and I took that opportunity. I was really happy I was ready to have a little bit of a career switch, and I thought it would be very exciting to work in preventing infections in our patients. I've seen them be treated for lots of infections, but to think that I could play an active part in preventing many of these infections in the first place was very attractive to me. It was a way to really make a positive impact. So here I am, been in this position for a couple of years, and I'm really pleased to have the opportunity to talk to you about infection prevention at Seattle Cancer Care Alliance this morning. At the Seattle Cancer Care Alliance, it is customary for us to begin our meetings with hand hygiene. It is a way to help keep the rooms clean, help keep ourselves healthy. And also it's just a moment when we acknowledge our commitment to patient safety, because hand hygiene is the most important way to prevent many hand-transmitted infections to patients. So it's a moment for us to think about this is keeping myself safe, it's keeping patients safe. It's a way to show our commitment to patient safety. So I'm going to do some hand hygiene. I'm going to start the bottles around. And if you wouldn't mind just doing hand hygiene as I'm starting, I'd appreciate it. Right. And you know I'm going to talk more about hand hygiene, so just get ready. Here we go. Okay, so the objectives of my talk this morning. I'm here to talk to you specifically about our very special patient population at the Seattle Cancer Care Alliance. I know many of you have probably worked in healthcare environments for many years, but we like to take a moment to just say, you know, we have a special patient population. Many of our patients are severely immunocompromised. Their immune systems just don't work like a normal person's immune system does. So something that would be a minor illness for us, a minor cold, can be major, have really major complications for them. So we are, and there are many other infections that can be transmitted in a healthcare environment that can be much, much more serious for our patients. So we want to talk about how to prevent that. And of course, frequent hand hygiene is the most important way to do it. It's very easy to do. It gets overlooked, but it is hands down the most important way to prevent infection in our patients. And we really want to drive home the importance of not interacting with these patients with weakened immune systems when you could be infectious. If you have cold symptoms, even though you feel okay, like you can do your job, if you have a cough or a sore throat, even though it's not impacting you too much, if you share that infection with a cancer patient with a weakened immune system, the consequences can be extremely serious. What's a little cold for you can turn into pneumonia for them. It can put them in the hospital. They can die. It can delay their transplant. It truly is very serious. So we'll talk about that. Talk about other wonderful infection prevention strategies we can all take to decrease our risk of getting infections. Getting your flu shot in the fall. Flu shots aren't perfect protection, but they're the best protection, or the best tool that we have to help reduce infection risk in this very vulnerable patient population. And it's good for yourself too, reduce your own risk. Talk about making sure you're up to date with your annual TB screening. We've all heard in the news about tuberculosis outbreaks in healthcare facilities, and the best way to prevent that is to do regular screening so you can catch anyone who may have converted early. You always want to catch things early before they go big. And also we want to make sure other important vaccinations are up to date. That's how you curb outbreaks, by making sure that your the large population where you're working is covered. We want to make sure people are covered with their measles, mumps, and rubella vaccination, that they've had their tetanus, diphtheria, and pertussis vaccinations. That's how we prevent the spread of infections like that. And then we're going to talk about standard and transmission precautions to protect yourself when you're interacting with patients with different types of infections. Very important. And also how to protect cross-contaminating the environment. Anytime you go into a patient's room, which can be contaminated, healthcare workers are in there, they're touching things with gloves. The patient may be up and around touching things. You touch things, you bring in a big bag that touches things, you carry it out into the environment afterwards, or if you go to interpret for another patient, you can bring things into their room. So we want to talk about ways to reduce risk of cross-contamination in the environment. Okay, let's see here. All right, so I call this the backpack slide. And I use the backpacks to illustrate the healthcare burdens of a healthy person and a person with, I'm going to say, leukemia. So, maybe this young woman right here, maybe she has seasonal allergies, maybe she has blisters, but other than that, she's pretty healthy. Those things aren't going to slow her down too much. If she gets a little cold, she'll feel a little bit under the weather, but she's going to keep going. It's not going to slow her down. Her bag of healthcare burdens is light. She's much more resilient. Whereas this man here who represents a leukemia patient, so say he has leukemia. So leukemia is a cancer of the blood. It can affect, when you have leukemia, your bone marrow, where your different blood cells are made, just isn't working right. So you're not making the right numbers of red blood cells that carry oxygen. You're not making the right numbers of white blood cells that fight infection. So he's anemic, he's tired. Also, he doesn't have the white blood cells, as many of them, or maybe, sometimes they're very, very neutropenic. If he gets an infection, he doesn't have the soldiers, so to speak, to fight off the infection. So a little cold like that, if he can't fight it off, he's down. Maybe he has some other complications as well. Maybe he has diabetes. Maybe he has asthma. He's probably depressed because of all this stuff. Maybe his social network he doesn't have a lot of support. So, if you give him a cold, he can't fight it off. His coping abilities isn't as well. He's very heavily burdened. He can fall over. You know what I mean? So these are other factors that can contribute to weakened immune systems in cancer patients, besides their disease or age-related leukemias, or things like diabetes that affect the immune system. People who are much older or really young, that just as you get older, your body stops making as many white blood cells. That's normal. So they can have that as well. The treatment that we give cancer patient, chemotherapy, also affects the production of white blood cells and red blood cells. So they have their disease, and then we give them their treatment, so that knocks them down even more. And then different medications that we can give, like steroids, for example, also affect the development of white blood cells. So increased risk from less immune system is an increased risk for opportunistic infections. So they're wide open for colds, for skin infections, terrible sinus infections, bloodstream infections. They're very vulnerable. So how do cancer patients get infections? There's lots of different ways to catch an infection. Children, say this is an unimmunized baby who caught the chicken pox. A chicken pox in a cancer patient is devastating. They can get encephalitis. They're in the hospital. They can die. So people who are coughing and don't practice good respiratory etiquette, people who just cough kind of like this, or cough into their hand and then touch your hand as opposed to coughing into your sleeve, or better yet, if you're in the SCCA. If you're a patient, you should be wearing a mask. If you're coughing a lot and you're not a patient, you really shouldn't be here, you know. Central lines, many of our patients have central lines, you know, so for chemotherapy, for frequent access for blood products, blood draws, hydration. But anytime you have a medical device in your system, that is another venue for infections, you know. So, and again, it goes back to hand hygiene as well. If you're touching the environment and not cleaning your hands before touching the medical device, that's the way that patients can transmit infections to themselves. Objects in the environment, things that we don't think about, clipboards, pens, door handles, counters, those are all objects where germs can trade places. They can transmit. You touch it, you touch something like that, it's on your hand, you scratch your face or you shake somebody's hand, that's an opportunity for transmission. And door handles, we mentioned that. So this is a slide of some statistics from the CDC about healthcare acquired infections. So healthcare acquired infections are infections patients catch after they've already been in the hospital. They go in the hospital to be treated for one thing, to get chemotherapy, to have a surgical procedure, and then they've been in the hospital for a few days, and bam, they get another infection, such as pneumonia, gastrointestinal illness like C. diff, or urinary tract infections, bloodstream infections, surgical site infections, other types of infections. So in 2011, when they collected all this data, the grand total of infections patients caught while they were in the hospital, not related to why they went into the hospital in the first place, was 721,800. And they broke that down to say at least 1 in 25 hospital patients admitted that year had at least one healthcare acquired infection. 75,000 hospitalized patients died of healthcare acquired infections during their hospitalization. So they went in for one thing and died of something else that they caught while they were in the hospital. 10% of cancer patients undergoing chemotherapy treatment end up hospitalized due to infection, and every 2 hours a patient dies from this complication. That's very sobering. So that's why I do what I do. I really want to prevent this as much as possible. There are many strategies we can do that aren't hard to do that can greatly increase and reduce the risk of patients getting these infections in the first place. So how do we do it? There are interventions to prevent person-to-person transmission, and there are interventions to prevent environment-to-person transmission. So person-to-person transmission, that gets to our precautions. Standard precautions, you know, at the SCCA are to do hand hygiene every time before entering a patient care room, whether it's an exam room or an infusion bay or a procedure suite bay. Our standard practice to reduce risk is to use the hand gel. And then once you're in the room, if you're touching the patient, you're going to do hand hygiene. I know you all don't touch the patient, but at a bare minimum, when you're going in the room, you should do hand hygiene. When you go out of the room, do hand hygiene. Yes?
I noticed there are at least 2 types of
hand gel?
Gel and certain kind
yes.
of area. Which is better?
They're equivalently effective at decontaminating the hands. People have a preference for one versus the other. That's why we have 2. They're both just as effective in sanitizing your hands. The white kind, the Avogard, has more skin conditioners in it. So it can be a little bit kinder to the skin. This kind also has skin conditioners, but it's not quite as, I don't want to use the word greasy, but the white kind leaves a little bit more of a residue on the hands that some people don't like. But some people like that because they feel like it's better for their skin. So we can't make everybody happy, but we try to give at least 2 choices for people in the facility to use so that they can quickly and easily sanitize their hands. Oh, and then I was going to talk about interventions to prevent environment-to-person transmission. So that gets back to, you know, wearing PPE when you're in the environment, even if you're not going to be interacting with the patient and getting body fluids for patients with certain infections. If you're in their environment, we want you to wear PPE. just because you're in that environment, and we don't want you to take the risk of getting anything that might be in that environment on you, so that you can take it with you when you go out into the common environment, or if you go in to interpret for another patient later in the day, which can very easily happen in this outpatient setting. I know I remember when I worked in the procedure suite, I would see an interpreter with one patient that I had in the morning, and then I would see them interpreting for someone else on the 4th floor or an infusion. So I know you all get around. So that's why it's important to wear your PPE, yes.
Sometimes my patients have like a enteric precaution.
Mm-hmm.
And then that patient go to the bathroom.
Mm-hmm.
And the bathroom has a sign that
Yes.
if you are enteric precaution patient, please turn the bathroom. But the person never turn. Should I?
I love that question. I say, and I think maybe they don't turn the sign if they don't speak English and they don't understand what it says. So I would be very grateful if you can tell them, or if you don't want to tell them directly, perhaps you could ask their nurse to say, I noticed this person isn't telling the sign. Would you mind letting them know? If I'm not sure, I don't know exactly what your work processes are and how much you can talk to the patient. I am very comfortable with you just saying, did you know that what that sign says, and help them understand.
Should I just quietly turn?
Well, I think it's an opportunity to educate the patient so they will know when they use the bathroom next time to turn it like that. So you can do that, or you can ask their nurse to explain to them how this works, because that's an education they should be getting when they first are placed in these precautions. There's patient education that they're supposed to get, but I know patients get told a lot of things, and it's impossible for them to remember everything that they are told. So that's why they need to hear it again and again and again. I mean, these patients have a lot going on. They just can't remember everything. And just because they hear it one time, they don't necessarily understand it. A lot of times they don't understand it the first time. So that's why it's helpful for them to hear it multiple times. Yeah, so that's actually really important. I'm going to talk more about that later on in the program, but I think it's great if you would say, did you know what that sign says? And if they have more questions, I would encourage you to let their nurse know and have their nurse explain it to them more. So I've talked a little bit about hand hygiene. It is our policy. This is something that we audit. Departments audit the staff hand hygiene practices because our practice is to gel in and gel out as a minimum safety practice. It's just a good have. You do something the same way every time, you reduce risk every time. So that's our practice, to gel in and gel out. And there are some occasions when it's more appropriate to wash with soap and water. Washing with soap and water is never wrong, of course not. But it's not always convenient. So that's why we have hand gel, because it's quick and easy. But there are some situations when you absolutely need to wash your hands. If they're visibly dirty, if you've been in the room of a patient with something like C. diff or norovirus, alcohol, hand gel doesn't kill C. diff and norovirus. So after leaving the environment of a patient in contact enteric precautions, we'll talk more about that in a minute, you would definitely want to use soap and water. And if you're going to do hand hygiene, you want to do it effectively. So I have step-by-step rules. It takes at least 15 seconds to use hand gel as a minimum. You want to get enough. You want to be rubbing your hands for at least 15 seconds. You just want to cover all the surfaces of your hands. When you wash your hands, it takes about 60 seconds. So singing happy birthday, 3 or 4 times is a good way to remember. You want to make sure you're rubbing soap all over your hands, rubbing your hands together for 15 to 20 seconds. And then it's a good idea to use a paper towel to turn off the faucet after you're done, because the faucets often are some of the most contaminated fixtures in a bathroom. So, you know, you go to all that trouble to wash your hands and then you contaminate them again when you turn off the sink, you know, I mean, just get it's better if you can get a paper towel and do that. So this is my site where you all can look at your blue cards. These blue cards are given to all SCCA staff at new employee orientation. So it's a guide for you to know what we tell staff at SCCA. One, respiratory virus symptom. So if you just have a cough or a sore throat, means you're likely infectious, which can be a serious risk to immunocompromised patients. Does everyone? I have more. If anyone else needs more of these, right here. Okay, here I'll send this stack around again because I know some people have come since I passed these out before. So SCCA staff who work in the clinic are told if you have one symptom of a respiratory virus, and I know this is kind of a radical thing in most workplaces, if you have just a little symptom, that's, you know, you should still come in and do your job, right? I mean, you're not incapacitated, but because of our special patient population, it's a patient safety issue to come to work when you're infectious. Because I've talked to you about the serious risk to our patients. So if you have one symptom of a respiratory virus, for SCCA staff, they are to stay home until their symptoms have significantly improved. Coughing, sneezing, nose blowing is infrequent, controllable, and does not interrupt patient care or work. What I tell staff when they say, can I come back to work yet? I tell them, can you read 2 or 3 paragraphs without having to cough or blow your nose? You know, get a drink of water. If you can't read, because when you're home, you're feeling better, you're not talking, if don't have people around you, you're not talking, so you're not coughing as much. But then when you start talking to other people, that's when people start coughing. So that's how I ask people to test themselves to see if their symptoms have improved enough for them to come back to work. And I know, you know, when you're interpreting, you're talking quite a bit. So it makes patients really, really uncomfortable to have someone around them who is coughing and sneezing for good reason. I mean, the consequences are really, as you all know, are very serious for them. So coughing, sneezing, nose blowing is infrequent, controllable, and does not interrupt patient care work. And it's been at least 24 hours after an onset of symptoms. You've all had colds. It's rare for a cold to be here and gone in 24 hours. That's just, you know, that's really rare. So if you get a cold, you know, most of the times we expect staff to be gone for 2 or 3 days. And I don't know what your work arrangements are. I don't know what your compensation is for when you're sick, but I'm just letting you know what our concerns are in the clinic and what the risks are to our patients, and just to make you aware of that and ask you to take precautions for the safety of the patients. For presumed influenza, you know, when there's a lot of flu going around, if you have a fever, a cough, sore throat, nasal congestion, runny nose, body aches, you should stay home if you have a fever, of course, 1 or more symptoms. And if you know that you have the flu, we just say, you know, at least 5 days after symptoms. Because I think this year in Washington State, we had over 300 deaths in the state of Washington from flu. None of them, amazingly, were SCCA patients. And part of that reason is because of our respiratory virus management plan, our staff education plan, our drive to get people immunized. All staff are required to get a flu shot or complete a declination process where they have to, if they have a medical reason for not getting a flu shot, they need to provide a doctor's note. They need to go through an education module. You want to make sure people are really, really well educated before they make the decision to not get a flu shot, because it's really important for us to reduce our risk. But yeah, we had no patients die from the flu this year, which is really incredible. Does anyone? Oh yes, good. I was just going to ask if there are questions.
So allergies mimic many of
Yes,
these,
they do. Yes, they do. That's a great question.
but it's not a virus. So
No.
if one has allergies, how does one manage that?
Well, the thing is, I'm one of those people that
Me
has
too.
seasonal allergies. And I get all the positive respiratory virus results. And I see lots of people who say they have seasonal allergies or they think it's a eosinophil-related cough or some other reason. And it turns out they also are positive for a respiratory virus. So it's all about controlled symptoms. But you can, it's very common, you know, especially in the spring and in the fall, to have seasonal allergies and a cold at the same time. Denial is a state of the human, you know, it's a normal thing. And I am very guilty of this. You know, it can be 4 days of symptoms before I finally break down and say, okay, it's not allergies, it's a cold. You know, but in this environment, we can't do that. So if you have uncontrollable symptoms, you really shouldn't be here, you know, because you can have both at the same time. You don't want to have both. You want to say, no, I'm fine, I just have seasonal allergies. But the truth is, people have both at the same time. And it's just, it's a true patient safety risk. So you want to make sure you're on medication, you know, I find something that works for you so you can control your symptoms.
Yeah, that's what I was going to say. Take some medicine for allergy and then you find out.
Yeah, well, you know, I encourage people who have this issue, have that condition, to see a doctor so you can get your symptoms controlled, because we have to work, right? So it's something that I've had to deal with being here 15 years.
I noticed I started working last year, July, and so SCCA offering flu vaccine.
Yes.
And I noticed there are at least 5 strains of
Flu?
yeah, in SCCA.
That's actually quadrivalent. We have a quadrivalent vaccine that fights against four strains of flu. Yes.
But if I go to, for example, glucose, they offer
The trivalent.
just only 1 strain.
Well, most vaccines nowadays are trivalent or quadrivalent. I don't know of a single valent vaccine.
Oh, okay. So
yeah.
Anywhere it's okay, or do you prefer people get the flu vaccine here? Because
no, it's fine to get it at every season. There's a couple companies who put out a flu vaccine. And they want to be competitive. So nowadays, most places are offering the quadrivalent vaccine, because so wherever you go, whether you go to Bartell's, whether you go to Rite Aid, whether you go to Group Health, everyone's going to have a quadrivalent vaccine. It's very rare. It's very rare, but people, I mean, if there's a quadrivalent vaccine, why would you want just a trivalent vaccine? Except unless you are over 65 and you're getting the high dose flu vaccine. That was only trivalent last year. That's the only reason I can think of to get a trivalent vaccine. But their standard vaccine was quadrivalent. Yeah, for protecting. So, but yeah, any flu vaccine is a good vaccine. So wherever you want to go to get it is fine. But just, you know, have your documentation so that can say, yes, I did my part in building herd immunity to help keep myself safe and the patient safe. No preference. It is free at the SCCA. Just saying, yeah, feel free to come to any of the staff flu vaccine clinics, and it's free. Yeah.
When you see a SCCA staff wearing a mask, what does it mean?
It should mean that they are either they've been setting up a sterile procedure, or that they're getting ready to go see a patient who's in droplet precautions, or they've just come out as seeing a patient in droplet precautions. But it is our policy that staff are not to wear masks at work because they have symptoms. If they have symptoms, they should not be here. You know, occasionally we have drift, or we have new staff, and sometimes they need to have that policy reinforced with them. But no, you know, staff should not be wearing a mask because they have symptoms. If they have symptoms, they should go home, because really masks can give a false sense of security for symptoms. The most important thing to do if you have symptoms, or if you're around someone who's sick, is to wash your hands, because the most common way of environment is when you touch something and then touch your face. With the mask, if you're wearing a mask, you know, it contains a lot of droplets. It can limit environment contamination. People take their mask off when they blow their nose. Masks are only, if I have a slide that will come to, I'll skip over it now since I'm talking about it, but masks are really only effective for about 30 minutes. After about 30 minutes, they start to get saturated from the breath vapor, and then they don't filter as well. So hand hygiene. Hand hygiene is most important to prevent infection. So this is how many of you have been with us through the past several months at the SCCA? Many of you. Okay, so many of you are familiar with the screening stickers. The screening stickers are a visual cue that we have for patients and caregivers and staff. It's a way to affirm that I have been screened for respiratory virus symptoms and I am clear. Or if you have a mask for patients who have been screened, they have a mask on so they're contained somewhat. It's the way that we reduce risk. And it's something that we ask every day because our symptoms change every day. You can't just screen for respiratory symptoms once a week when you're in a cancer center, with patients, because you can wake up one morning and have a sore throat when you were fine the day before. So that's what the deal is with that. Every year we start, right now we're at what we call baseline because the level of circulating respiratory viruses in the community is low. It's not flu season right now. There aren't so many people with colds. But starting every October or sooner, if there start to be more colds in the community, we move to what we call level 1, which means we start screening all patients and their caregivers when they check in for their first appointment of the day. So they check in for their first appointment of the day and they say, okay, my name is so-and-so. I'm here to see Dr. So-and-so at 5. And the person at the front desk says, great, I'm checking you in. Do you have any cold or flu symptoms today? Do you have a cough? Do you have a sore throat? Many of you are probably familiar with that. And they say, no, I'm good. Great. Here's a sticker for you to wear. They say, oh, I have a new cough today. Oh, I'm sorry to hear that. Will you please wear this mask while you're in the clinic today? And would you like some hand gel? Please feel free to use the hand gel throughout the clinic today. So that's a way that we identify and take steps to reduce risk as soon as we can when the patient checks in. At level 2, even though staff screen themselves 365 days a year, they should not be coming to work ever with symptoms. At level 2 is a sign of solidarity to reassure patients. Staff also start wearing stickers. So this usually starts like around November, October as the number of viruses in the clinic, in the community, and then it starts to overflow into the clinic, starts to grow. We do that as solidarity with the patients. Level 3, we don't go to every year, thank goodness. Level 3 would be when we see indications of active intraclinic transmission of viruses. If we see clusters of infections, we have a couple of off-site locations where patients from out of the area live, the Pete Gross House and the SCCA house. If we start seeing signs of clusters of colds and flu there, or colds and flu anyplace else in the clinic or in, among staff, then we go to level 3, which means we have staff stationed in front of the main entrance of the clinic and also in front of the garage elevators. So we catch everyone as soon as they cross our threshold. We screen them then and there before they even, can get to blood draw or go up the elevator and say, do you have any cold or flu symptoms today? And if they do and they're not a patient, we say, due to our concerns about respiratory virus outbreak, could you please reschedule your visit? If they're a vendor, we turn them around. This really is very serious business to us. So this is my slide just to, again, mention the importance, really, really critical importance of making sure TB screening and vaccinations are up to date. Does anyone know why I have a Mickey Mouse balloon there? Does anyone know what that's about? A couple of years ago, we had a measles outbreak at Disneyland. Yeah, it started with one person and it spread to, I want to say like 170, 180 people. Most of them on the West Coast from one person at Disneyland. And there were other people at Disneyland that hadn't been vaccinated and they went home. Some of them came home to Washington State and spread measles. So measles is extremely, extremely contagious. Many of our patients have been immunized at some time in their life, but when they're going through a bone marrow transplant, they have no immune system. They're not covered. They have no way to fight this off, and measles can be deadly. So things like that, these things that we think about, those immunizations are very, very critically important. Varicella, it's really important to make sure that you've either had the chicken pox or had the varicella vaccine. Also shingles. We're all old enough to many of us are old enough to get shingles, and the important thing to think about, you don't catch shingles from shingles, but someone who is immunocompromised can get chicken pox from shingles, and that has happened in our patient population. So if any of you get a shingles type rash, do you all know what shingles is like? You get like this painful rash, just like a band, like on your ribs or on your back or on your leg or some on your neck. If you get something like that, it tingles and then it hurts and you get these vesicles, think, oh, shingles. Oh my gosh, I can't go into work. Because, a person with a weakened immune system can get chicken pox. What do I do? Did I touch something?
Maybe on the
Oh, I apologize.
Can you close it with snow? Is that right?
Not that.
Too much coffee. I'm seeing double.
Wow. Dangerous. Oh, here I am. Okay. Great. Thank you. Quick recovery. Excellent. And we've talked about the importance of the flu vaccine. So in the interest of time, I'm going to scoot along. Okay, so now we're going to talk about standard precautions and transmission precautions. And you guys have all seen these signs, right? Oops, how am I going to do this? Because I need to show stuff. Should I put on the belt now? I need to use both hands. I didn't think about this. Okay. This is sure.
Yep.
My jeans or something. I should have done this at the beginning. I didn't. Here. Okay, that's working. Good. Okay, so you all have seen these signs right here outside the patient rooms. So standard precautions is for every single patient. For every single patient, we want to clean hands when we enter and leave the room. We want to cover our mouth and nose with arm or tissue when coughing or sneezing. Contain. And then doctors and staff must gown and glove if soiling likely. So if they think they're going to come into contact with any type of body fluid, they need to wear gloves, or depending on what else, gowns, mask, eye protection, which is wear mask and eye cover if splashing body fluids are likely. So that's for every single patient. So then we get it. So that's standard precautions. Transmission precautions are special precautions that are put in place because of an infection. So if you need transmission precautions for a particular infection or a condition, if a patient has a wound that they just can't contain, or they're having ongoing diarrhea, you can consider that to be really contaminated. So you're going to use transmission precautions. So that means you would wear PPE just when you go into the room, just to reduce your risk. So standard precautions is hand hygiene and just wearing PPE if you're coming into contact with body fluids. Transmission precautions, you wear PPE when crossing the threshold into the room to prevent risk of contamination to yourself and cross-contamination to the environment afterwards. All right, so I'm not touching the patient. Do I still need to wear PPE? So family members aren't required to wear PPE because they will not be going into other patients' rooms. So that's the difference between, say, you and a family member, for example. The family member is just, they're not going to go into another patient's room where they're receiving care, whereas you have the potential to do that. Okay, so what's contaminated? When you look into a room, even a room like this, you don't know who else has been there and what they've been doing while they were in there. So that's why we just assume the room is contaminated. Assume all surfaces are contaminated when you're going into a room with some type of precautions. If it's not a yellow sign outside the room, then you just need to assume that the room is contaminated. And just take a stand, it's a precaution. Just put on your PPE because you just don't know and you don't want to make any assumptions.
I have a question about PPE. Like we go to interpret for a patient who get chemotherapy.
Yes.
Sometimes we need to stay so close with the patient because
yes.
the patient has hearing impairment, but do we need to wear PPE too?
If you're not handling the PPE, you're not handling lines, you're not injecting any PPE, so I'll say no. The nurse needs to wear PPE because they are handling the drug itself. If you were in the vicinity of a chemo spill, well then, I don't know why you might need to be there, but if there was a chemo spill, then yes, you would need to wear PPE. But for the patient, if you're just translating for the patient, no, you don't need to wear chemo PPE. You're not handling PPE, so you don't need to wear it.
I got an interjection there.
Yes.
I would wear it anyways in case sometimes there are situations where you need to help and your instinct, you automatically try to help. And if you're not dressed for it, then you get contaminated.
Well, so can you give me an example?
Well, once I go to Seattle Children's a lot. Kids sometimes they move around and stuff like that.
Sure.
So when they're doing a procedure or something like that, then sometimes they need a third person.
Oh, for a procedure.
Right.
For a procedure, yes, you would wear
Even though I'm
PPE.
standing back and interpreting,
yes.
I think it's a good idea to be ready in case you're needed.
Yeah, so procedure is different from chemotherapy.
Oh, I got you.
Yeah, she has specifically. So we're going to talk about that in a moment. And that's a very good point. Okay, so I've shown you the yellow sign. And standard precautions, I have pictures just of these things. Big bags, laptops, phones. These are things that might get brought into a room that can be objects that can collect germs and they can be vehicles for germs to travel outside of a room. So I just ask you all to be mindful of what you bring into your room, especially if it's not a yellow sign. If you're considering the environment contaminated, when you're coming in, you're putting your bag or your laptop or whatever on a chair that could also be contaminated, and then you're taking it out of the room afterwards. That is a vehicle for cross-contamination. So I just would like you all to be aware of that and try to limit what you bring into a patient's room as much as possible. So contact precautions. So I'm just going to go through these signs really quick. Examples of infections that would need contact precautions include things like MRSA, bed bugs, wounds with uncontained drainage. So for contact precautions, you always want to clean your hands when you come in the room and when you leave the room. And then everyone leaving the room, or everyone entering the room needs to wear gown and gloves, for PPE. You want to clean and disinfect shared equipment. On the back of these signs, it talks about room cleaning. It talks about clean and disinfect reusable equipment, including IV pumps, cell phone, or pagers. How many of you use a cell phone or a pager or a laptop in your room? Yeah. And do you always clean it when you go out of the room? Yeah. So we have we have new wipes that you can use. Many of you may have seen them. They're called the Easy Screen wipes. They're basically like a big alcohol prep pad, but they're a really quick and easy way to clean the surface of your phone. You can also use a disinfectant wipe on your phone and you can clean residue off afterwards. But that's something that we are trying to raise awareness about, because you do your hand hygiene and then you touch your phone. you know, after touching other things. So that's just something you want to raise awareness with to people. And again, limit, you know, bring what you bring into you, stuff that you bring out that you touched while you were in the room. You should clean, you know, when you leave the room, so you can reduce the risk of cross-contamination in the environment. Contact enteric precautions. As you can see, the sign is brown, and it's very appropriate because contact enteric precautions is for things like C. diff and norovirus. Many patients who have these infections have a lot of diarrhea. We actually didn't make the color of this sign. The Washington State Hospital Association made the colors of the sign, but you know, it's helpful. It's helpful to remember. If you see a brown sign, you're going to want to clean your hands with sanitizer when you go in. It's fine, but when you come out of the room, you want to use soap and water. See all the suds and the water there? Because alcohol doesn't kill C. diff. So if you see a brown sign, of course, you're going to want to wear your gown and glove. And when you come out of the room, you want to use soap and water. Or if you want to wipe something down, you want to wipe it down with the bleach wipes, because the other types of wipes aren't as effective on C. diff and norovirus. Droplet precautions is what we use for patients with cold symptoms, different types of cold viruses, influenza, RSV. So everyone, of course, clean their hands when they go in the room. They wear, you want to wear eye protection and a mask to protect your mucous membranes from droplets if the patient is coughing in the room. And you want to wear a gown and glove to reduce contaminating your clothes, you know, so you don't, you know, have a patient cough on you and then you touch your clothes later and infect yourself. And I want to take a moment to say eye protection is really important. For years and years, regular glasses used to be considered okay for eye protection, but they've done research that shows that you can still be contaminated. And actually, when I used to do procedures, I did squirt myself with lidocaine on more than one occasion. Because our glasses are small, they have gaps through here, you know, so you can be exposed that way. Also, if someone coughs in your face and you go out of the room and you're going about and you take off your gown, your gloves, and your mask, and you do your hand hygiene, but you don't wash your glasses, and then you reach up later and touch your glasses and scratch your nose, bingo, you can contaminate yourself. So you want to cover all your mucous membranes. So this slide talks a little bit about the difference between droplet and airborne infections. So for like colds and the flu, that's what we call droplet precautions, because with those types of infections, when you cough, the infectious particles are in droplets that are pretty big. So a person with a cold coughs or sneezes, they cough and sneeze out droplets that go, you know, achoo, they go about this far and then they go down. Whereas someone with an airborne infection such as tuberculosis or measles or SARS, those infectious droplets are much tinier particles that, because they're so small, they can be suspended in the air for longer periods of time. So they don't just go, they are much smaller, they just they float around. So that's the difference between cold, RSV, the flu versus tuberculosis, measles, or chickenpox. Chickenpox and shingles, those are also airborne. The particles are smaller. So that's helpful, because sometimes people think, you know, that person has a cold. You know, if we leave the door open, the infections are going to spread out the door, but that's not the case because the droplets just go down like that. Whereas with tuberculosis or chickenpox, that's airborne. It can spread a little bit more. Okay, so this is my slide about patient education about wearing masks. I know you all spend a lot of time with patients wearing masks. So I just thought this might be helpful for you to see. Wearing masks helps decrease the spread of infectious droplets onto surfaces in the environment. So it decreases the infection of the surfaces. Masks need to cover the nose, the mouth, and the chin in order to be protective. Masks should be changed about every 30 to 60 minutes, depending on the amount of patient coughing or talking. Masks should be thrown into the garbage after each use. They should never be saved. They are infectious. Masks are really cheap. And we want them you don't want patients to be thrifty with masks. We want them to throw them away and get a new one. That's what we want. So we don't want them to try to save us money. We want them to get a new mask each time. And then it's also, masks are considered extremely contaminated. So after they take a mask off, or if you take a mask off yourself, should always sanitize, clean the hands afterwards. So we talked a little bit about airborne infections. This is the sign for airborne precautions. This is airborne contact precautions for people with shingles. So the concern with shingles or chickenpox are people who aren't immune to the disease. If you're immune, you don't need to wear a mask when you're going in to see this patient. But you do need to wear a gown and gloves so you don't take anything that's in that contaminated environment with you when you go to the elevator where a bone marrow transplant patient might be going. So that's why we would have you do that. And these patients need to be in an airborne infection isolation room. Does anyone know where the airborne infection isolation rooms are in the SCCA? We only have 2 of them in the whole building. Does anyone know where they are? That's right, they're on the 5th floor infusion. That's the only place. So if there's a patient who has shingles and they're scheduled for blood draw and an MRI and maybe some other appointment, and it's discovered they have shingles, everything needs to stop. They need to get a mask on and they need to be transferred to infusion, airborne infection isolation. They shouldn't just, be going about the clinic, and they need to be escorted by a staff member. It should be a staff member, right? and like a nursing assistant or something like that. And then they need to go on the service elevator and then up to infusion for that. If their appointment can be rescheduled, that's also great. But they can't just continue as they normally would because of the infection risk to our patient population. Airborne respirator precautions would be for patients, and in our facility, it's most commonly for patients who are being ruled out for active tuberculosis. And this comes up, sometimes the patient develops metastases in their lungs, and they look at it and think, oh, maybe they had latent TB and it's activated, or sometimes they're being evaluated for lung cancer versus infection. So until that has been determined, if they meet certain screening criteria, we are obligated, because of to protect our patients and to protect our staff, to put these patients in airborne respirator precautions, which means when these patients come into the clinic, they should come to the main desk on the 1st floor so that they know that they're here. They should get a mask right away. The front desk should call infusion to make sure that they have an airborne infection isolation room ready. And then they will have a staff to escort that patient via the service elevator just to decrease risk to the airborne infection isolation room. The challenge is that many of these patients don't speak English, well. So have any of you interacted with any patients who are in airborne precautions? Yeah, how did that go? How did that work?
Well, you go in, they will kind of tell you how to put the mask on,
Yeah.
and which one can be reused, which one you have to throw it away or put it. So you gotta wait until the patient goes in there first, and then the doctor will come in. Okay.
Yeah, well, we're going to talk more about that because that's something I'd like to learn more from you all about the training that you get for wearing PAPRs or respirator masks, because it's important protection. So again, airborne precautions, special patient info. Patients with airborne infections must wear masks when traveling in the clinic unless they are in an airborne infection isolation room. So at all times when they're in the clinic, unless they're in an airborne infection isolation room, they need to wear a mask. Some examples of airborne infections include shingles, chickenpox, and active tuberculosis. Patients should have all appointments in the airborne infection isolation room. At South Lake Union, there are only 2 airborne infection isolation rooms located on the 5th floor in infusion. There are no airborne infection isolation rooms at SCCA, Northwest Hospital, or Evergreen. So what do you do if you find out the patient you are to interpret for as airborne precautions? My concern is for your safety. Using the N95 respirator masks, those are not effective if they don't fit you right. So if you haven't been fit tested to wear one of those paper respirator masks, you shouldn't wear those because your protection from those masks is not assured. The respirators themselves, you need to be trained to wear. So I don't know what your training practices are. That's something I would like to understand better. So I'm mentioning that as a concern, and I would be interested to know what your process is for training for that, because it is an OSHA requirement.
We don't have any further training in this regard.
Okay.
All the training that would be provided would be before.
Yeah, so it would be just-in-time training. So it would be great to have a more standardized process, because for healthcare workers, they have to do, it's an OSHA requirement that we have to do a respirator questionnaire to make sure that physically it is safe for us to wear this special equipment, and then we have to receive training on how to operate it.
Even that time, the nurse, the doctor, and myself were all doing it the first time.
Yeah.
We were reading from the brochure.
Well, that's something we want to do better, because we want to make sure that people are safe when they do that. Do they use video interpreters here at the SCCA? Do we have that capability?
Yes, we have that capability. Yeah.
So would that be an option in a situation like this, Evelyn?
Yes.
Okay. So maybe we can talk more about that, because I want to make sure that we are keeping each other safe. We need to advocate for the patient, but we need to advocate for staff safety as well. Yes. Yes.
I worked in another hospital for 9 years, and every year we had to do the test.
So the interpreters did that.
The interpreters and
through occupational health. Were you employed by the hospital?
in-house interpreters. In-house interpreters.
Okay, but as a vendor, yeah, I'm not sure how that will work. But if you're going in to see a patient in Airborne Precautions, you need to have that level of training. So we're in the beginning discussions of how to do that better. We want to do it better. So interpreting during sterile procedures, if you are close to the sterile field, you need to wear appropriate protection so that you won't be contaminating the sterile. How many of you have interpreted during sterile procedures? Many of you. So if you go to IR, for example, you get to wear, do they still have you wear the white suit? Yeah, and that's just, even though your clothes look clean, they can have dander, dust, a lot of things on them. So that's why you get to wear those. Shoe covers, because we want to, again, control the environment. Hair protection, even if someone's bald, they still need to wear head protection because we have skin flakes, that can contaminate the environment. And then you want to protect your mucous membranes, and also protect from contaminating the environment with your droplets. So now this is the time, and we got to go quick. I'm going to do a quick demonstration with the PPE. How many of you have seen our new 3-armed gowns that we have? Have you tried them on?
I like them.
You like them? Oh, good. Well, I'm going to do a formal. We've just started rolling these out, and I wanted to give you all a formal demonstration on how to use these. And we've changed to this style of gown because we wanted to get rid of the ties. The ties are difficult for many people, and also a lot of times people don't tie the back, and so their back is exposed to contamination. Yes.
Especially for interpreters, you go in and out the room many times because you have to wait outside. The provider is not present at the time of the treatment. So putting on and going and put it, I think that takes a lot of time.
Yes, it does. So this is much quicker and easier. The pinstripes look sharp. They're also carbon fiber, so it reduces static in the gown. Isn't that wonderful? Yeah. These are also more fluid resistant. But it is a little bit, when you first see them the first time, you think, how do I do this? A 3-arm gown? What the heck is that? So I'm going to show you right now. I'm going to do a demonstration, and then you all are going to partner up and demonstrate for each other, and you can go through the form and check each other off, and you will be confident. All right, so I need you all to, you need to watch him, he needs to watch you. You go through the process, and then you sign each other's forms, and then you'll give them to your manager, and that will show that you have had formal training on how to do PPE to keep yourself safe. All right, so this is going to go really fast because we're almost out of time. So anytime you do your PPE, the first thing you do, your standard practice to reduce risk is what? What do I do first? Hand hygiene, yes. I'm always going to do my hand hygiene first. Okay. I do? Oh, okay. Oh, thank you. Thank you so much. Well, you guys get an opportunity to move around a little bit too. You have a long day ahead of you. So this is an opportunity for you to get up and move around. But first, I'll do a quick demonstration. And then you all, I wonder, could I have help from you all in passing out gowns? To everyone, I have gowns here, and I have gowns here. Now, these are my training gowns. So these have been used by other staff to practice putting them on. They have not been used for patient care. So I just want you to feel okay about putting them. They've obviously been worn before, but they've been just been worn by staff from practice. Okay, so I'm going to start my demonstration. So you can see this gown has 3 arms. You put it on opposite from what you do now. You put it on like a jacket with the tag in the back. So I'm going to put this on. Thank you. Okay, and then here's my 3rd arm right here. For ladies, this will remind you of a wraparound dress. All right, for men, you will have the experience of doing a wraparound dress. So how about that? There's Velcro here and Velcro here. Bam, I'm all dressed, front and back covered. See how easy that was? And then I'm going to pretend like I'm going in to see a patient with the flu. So I'm going to cover all my mucous membranes. I'm going to put my mask. Yes, I'd like everyone to be watching me right now, and then you will do it with each other.
Can I have your attention shift to the forward?
Thank you so much. Okay, so I have my mask on to decrease fogging. I'm pinching my mask with the nose. I'm wearing, I want the eye shield to protect my glasses. And then I'm going to put my mask on, my gloves on. When I put my gloves on, I want the cuffs of the gloves to cover the cuffs of the gown. So to reduce gaps, to reduce infecting myself. And also with the cuffs of the cuffs of the gown covered, I can reduce contamination to the cuffs, so when I take off the gown, I'm less likely to contaminate myself. All right, so I'm all dressed up. I'm ready to go in and be in the patient environment. I'm done. So I'm going to take my PPE off, either just inside or just outside the room, once I'm, quite a distance from the patient. First thing I do, and this is different, right now with the tie gowns, you take your gloves off first because they're contaminated, and you don't want to contaminate yourself when you're taking the ties off. You would take your gloves off first. But with this gown, you have to touch it to take it off. So with my gloves still on, touch the gown, take that off. Now I'm going to take my gloves off. And I'm worried I might have contaminated myself when taking off my gloves. So I'm going to do hand hygiene, my standard practice to reduce risk. Then I'm going to take my gown off. To do that, I want to touch the outside of the gown as little as possible. So I'm going to touch the inside of the gown and just kind of slip it off my shoulders. And then I'm going to put my finger under the cuff like that. I'm grabbing the sleeve. This is the tricky part. You guys will get it. Once you do it a couple times, it's easy. Now I'm going inside out like that. See, I'm not touching the outside of the gown. I don't want to do that. Like that. Gown is inside out. I did not touch the outside of the gown. Now I'm going to roll it up. I don't want to flap it around, nothing like that. No. I'm going to neatly roll it up like this. If you see a doctor doing that, you need to give them a really dirty look. But they're getting training as well, but you can reinforce that. Put that in the hamper. And I'm going to take off since my eye protection and mask is combined, I'm just going to do it all at the last. See, that's the nice thing about having a combined mask like that. Throw that away. There's garbage up there. Good. And then, of course, my standard practice, because even though I am really, really super careful, I could have contaminated myself while taking off my contaminated PPE. So I'm always, as a standard practice to reduce risk, always I finish with hand hygiene. All right?
You do hand hygiene twice. When was the first one again? Before
I took it off after I took my gloves off.
After you took your gloves off,
if I was worried about my gown, if I had been taking care of a patient, had a lot of body fluids, or, I just, if I'd been doing close physical contact, I would have done hand hygiene after taking off my gown as well. But in the situation where I'm not, not touching the patient, I'm just sitting there, or I just briefly came in and talked to the patient. Even if I'm just going in to talk to the patient, I'm still going to put my gown on because I don't know what's going to happen once I go in there as a nurse. In the past, I go in there just to ask a question. Oh, can you get this for me? Or, oh, I'm going to throw up. I mean, you just never know what's going to happen. So my standard practice when going into a room with the patient in precautions is to wear the full PPE. That's actually a requirement. That's expected of staff. If you see a sign like this outside the room, if you cross the threshold, you should have done hand hygiene. You should have your PPE on and be ready for anything. Yes?
Don't wear shoe protection?
No, you don't need to wear shoe protection. Okay. Floors are considered contaminated. I mean, we clean the floors, but patients aren't down on the floors. We're not touching the floors with our hands. So no. If you were in an operating room, or if you were in a room where they were doing an endoscopy procedure, where you were worried about, body fluids getting on the floor, well, then that would be a time when it would be appropriate to wear shoe covers. But in the general environment, when people's body fluids are contained, it's not indicated.
I was wondering if we could go over like the proper way to gel your hands, because I've heard you're supposed to sort of get your. Is that still a thing? Or
well, it's a thing for some people, but it's not. What's most important is just make sure you're covering all the surfaces of your hands. There can be like there's like this little, I call it the hand hygiene Macarena. Yeah. And I think that's awesome for people who want to do that every time, but it's not the only way to completely cover your hands. You just want to make sure you're covering all surfaces of your hands. Areas that people often miss are like in between. So that's why when you do that, I'll call it the hand hygiene Macarena, they have you go like this and like this. And you do like this to get the fingertips. And that's awesome. If you want to do that every time, go for it. But mostly you just want to make sure if you're spending 15 seconds doing this, like this, then I think you're gonna cover yourself okay. But that's great. Yeah.
It's a good hand massage too.
Yeah. That too. But you want to do hand hygiene like you mean it. And you look at your patient and say, you think to yourself, I'm doing this to protect you. And you look out in the hall and say, I'm doing this to protect you too. Just think about that when you're taking your 15 seconds. It's a moment to reflect. We all need those moments, right? Okay, great. If you guys want to do your PPE, donning and doffing, sign yourself off.